That's a 165% increase since last week. The test positivity rate has doubled since last week to 2.5%. And CBS 2's Jeff Nguyen is live in Burbank, where one hospital is seeing a reverse in the trends there. Jeff?
And that trend line has been moving in the wrong direction, but doctors say what has been holding steady has been the effectiveness of the vaccines.
A couple of weeks ago, we started to see a trickling in of coronavirus patients, but in the last week, I've seen a significant rise.
Dr. Angelique Campen is an emergency physician at Providence St. Joseph Medical Center in Burbank. She says after months of declines, she's been seeing an uptick in coronavirus infections, even among the fully vaccinated.
So when you're vaccinated, you can still get COVID, but you will have a significantly lower chance of getting sick from it, and significantly lower chance of passing it on to anyone.
She says she and her colleagues have yet to hospitalize anyone who's fully vaccinated. This comes as LA County struggles with slowing daily vaccination rates. Add to that the spread of the highly infectious Delta variant. The director of LA County's Department of Public Health spoke on KCAL 9 News at 4 about how rare it's been for fully vaccinated people to test positive for COVID.
Slightly less than 1% of people who are infected are people who are fully vaccinated.
Dr. Barbara Ferrer says children who aren't old enough for vaccination should limit group activities to outdoor settings.
This isn't the time to go ahead and have a huge birthday party inside.
Back at Providence St. Joe, the hospital doesn't test for the type of coronavirus people contract. But if a patient is vaccinated, a sample of the positive test is sent to the health department.
100%, every patient that I've had to hospitalize due to COVID-19 has been unvaccinated.
And both of those doctors are urging people who have not been vaccinated to do so to lower the odds of more variants from showing up. We're live in Burbank. Jeff Nguyen, CBS 2 News.
And tonight, Pfizer says it will ask U.S. regulators to